Welcome to Health Talk. Today we're going to talk about linguistic barriers to healthcare. With us today we have Kimberly Pham and Audris Chang, and they're my pre-medical interns applying to medical school. And in my office we found out that one of the problems is that in California we have 168 languages, and we come across this every day, don't we? Mm-hmm. And what is it that you found in dealing with our patients in our office?
Well, since there are so many different language barriers, and it really is not even just language, but cultural differences as well, it's really difficult to connect with the patient, make sure they understand what we're telling them, and most importantly, to have them trust us in handling their health care.
One of the important pieces of legislation in America occurred when this book was written, The Spirit Catches You and You Fall Down. It's written by Anne Fadiman, won the Pulitzer Prize. She's 2 years or 1 year ahead of me in college from Harvard. And it's a very interesting book because it really tells the story of a Hmong family in the Fresno, Sacramento area, where what happened was this child, the family did not speak English, and this little child had a seizure disorder. So not only did the people not speak English, spoke Hmong language, which is not one of the major Asian languages. They were settled there post-Vietnam, this type of community. And this child, because the family did not speak English, believed in having a shaman present, a medicine man, recite incantations, and which is sort of a type of a Buddhist belief, that they really could not get the family and the child to take the correct medicines to prevent the seizure disorder. And ultimately, the child came into the emergency room and had a very severe seizure. Nobody could treat the child. They had to start IVs and intervene. The child went into a coma, and the child suffered brain damage and is now has severe developmental delay. At the end of the story, the child is an older child, probably age 10 or so, and it chronicles the point of view of the Caucasian physicians who did not speak any Asian language and the point of view of the family. It does it in a very moving way, such that President Clinton in 1998 passed a law that required all physicians who work in hospitals that take any federal money to have a cultural competency course. And this is required for everybody in America that practices in any U.S. hospital that receives money, which is virtually every hospital. And what the take-home message is that even though having a translator is not enough, is to understand that when an Arabic family comes to you, they want to be treated a certain way, and certain families, such as Japanese families or Chinese families or other East Asian families, the beloved patient could be their beloved grandmother, the matriarch of the family, and it's the number one son that takes care of them, and all the communication is through the number one son. Is that true in the Vietnamese community as well?
I think it is, yeah. Like a lot of times, like older patients don't know how to speak Vietnamese, and so they bring their children with them, like to their appointments.
And so it's very important that the doctor establishes some sort of rapport through these cultural boundaries, that we care about grandma, you know, maybe touching them on the shoulder or shaking the patient's hand with both hands. And some people believe in bowing to them, to the elder, because age is much more important than any other status in these societies. And it's important in Mexican culture, Spanish culture, that we accept their embrace, that the patients feel very warm towards the doctor, they will hug you, and that we cannot feel in sort of the Judeo-Christian Germanic approach to medicine, that we recoil because we're not used to being touched by the family or having the family member hug us. And so it's important to understand that every culture is slightly different. We have to be open to how they want us to communicate. And in Arabic culture, the women do not want to be touched. They do not want to shake your hands. And that's not an affront. It's just that they do not believe in having a male physician touch them in any way, including their hand. They don't want to shake their hands. And that, and sometimes in Arabic culture, I was asked as a resident to take care of the Saudi royal family in New York Hospital, Cornell, 68th Street, New York, and I was the female resident on call for the eye service. And this was before the chief of ophthalmology could reach me because I had just come out of the OR. I was supposed to be designated to draw blood from one of the Saudi royal princes. And they told me, don't get Gloria, don't send her, send a male. And before that, they couldn't get me. They had the Secret Service there with the Saudi prince. I'm drawing blood, and I got the blood. It was okay. But it turned out they tried to stop me from being there because they didn't want a woman doctor. They wanted a male doctor. And so it's very important for us to understand that these are cultural barriers, and they may ask to have your male associate see them rather than the female associate. And that's considered totally okay. Whereas we might think equal opportunity, equal opportunity commission, this is, politically incorrect. But we must understand the cultural barriers. And I think in what happened in this book, why this changed American medicine in this way to make all doctors culturally sensitive, it made us realize that had these doctors in Central Valley, California, had they were able to have a translator available, this child could have been saved. And now that's also a reason why every hospital that receives federal funds has a telephone service that links you to a translator. By law, in every emergency room, you can request that. However, it is unfortunate, as I said, there are 168 languages in California, 168 languages in New York, big cities like that, that sometimes there's a wait. You may not be able to get this language, Ethiopian language or some other language quickly, on call, on command, 3 o'clock in the morning, heart attack. So it's important to have family members and have ways for your family member to maybe have a index card in English in the wall at all times, their allergies, their medications, buy the ID bracelet, what they're allergic to. And you told me you took a interpreting class.
Right.
Tell us about that.
Yeah, so my interpreting class was based on understanding patients, their cultural differences, and also making sure to help the patient feel comfortable. A big problem with interpretation is actually that if the interpreter stands in between the doctor and the patient, they might feel a kind of break in the connection, and they won't be able to really trust the doctor, and they end up trusting the interpreter instead. So instead, we're taught that interpreters should stand beside the patient, a little behind, so that the patient can really be communicating with the doctor, even with a language barrier. And even with interpreters over the phone, it's still rather difficult because there's that disconnect and that little pause in between when translating. And so it's really important to try to get an interpreter on site to help with the translation process.
I think in South Bay in California, we have a vibrant community of many cultures. And so we have the Chinese newspaper, which is called the World Journal. We have the Vietnamese newspaper. We have that in our waiting rooms. And we also have a Japanese newspaper. They're all free weekly. This is J Weekly. And this allows patients to feel more culturally at home in your office, that you, the doctor, you accept their culture, you understand, you at least provide them with reading material that they can see what's going on. I think another problem is in our office, as you've noticed, in our Vietnamese patients who come, many of them are very nervous. Tell us why they might be nervous.
I think because a lot of times, like, they're not exactly sure if they're interpreting what you're saying to them, like, correctly, and like they want to make sure they have the correct diagnosis so that they can take the right medications and things like that. And a lot of them are afraid of, like what they're going to hear from you, and a lot of them are not sure what they're supposed to do. And so like that's why it's really important to have like Vietnamese speaking people who work there, and having a diverse group of employees to help out.
Yeah, I think in meeting this patient population, which is becoming more diverse, and as the change in healthcare occurs in 2014, where more people will have access to medical care, that we as a country and we as doctors know that the population is becoming more diverse. We're all becoming not just a community that speaks English. For example, 8% have a problem with English literacy. The First Lady, Barbara Bush, identified 10% of the American public reading at less than third grade English. So many of our consents for procedures are written in 11th grade English. And there have been articles published in New England Journal of Medicine and in major journals such as JAMA, Journal of the American Medical Association. Even today, 2010, 2011, Atlanta, Georgia, looking at large clinics, even populations where they are Americans, they are white, but they're rural, they're poorly educated, they don't have the education of understanding what it means, fetus, you know, first term, second term, third term, trimester, fancy words. They don't understand what biopsy means. They don't understand what it means to have stem cell. What is a monoclonal antibody? It is very hard to explain to grandma what is a monoclonal antibody. What is a virus? What does it mean to have genome? What is the human genome? How do we explain that? Because so much of technology and medicine is tied together now. And so to explain in an informed way the consent, we're going to do laser into your eye, we're going to take a piece of tissue, examine under the microscope, and then make the diagnosis about cancer, such as for breast cancer. We have to explain it in terms that are third grade level to some of these people who come from a farm, who never went to school, or they came from a different country where they were not educated in that country either. So they're illiterate in their own language in that country, and they're illiterate in English. So we have to explain either by pictures, because we want these people to feel taken care of, because we want them to feel comfortable with us as a healthcare practitioner, because if they have no trust in us, we can't get them to the journey of a cure or the journey of better health. So what do you think in translating for the Chinese community? We have diverse Chinese populations too. Tell us a little bit about that.
Well, in Chinese community, there are a lot of different, I guess, methods in medicine. So they can choose to come see an American doctor, or they can also see a Chinese herbalist. And a lot of people in the Chinese community end up taking Chinese medicine on top of medicine that their American doctors prescribe. And sometimes these different interactions might also cause problems, especially if they don't communicate all the methods that they're taking and all the treatment they're taking.
Because some of these Chinese herbal medicines, for example, digoxin comes from a plant. They could be taking that. I went to a Chinese herbal medicine clinic, and I looked through all the drawers. One of them was my friend, and they have ephedrine there. So that's a very powerful heart drug. So they could be taking that, and they're not telling you, and maybe there's going to be a complication. And there's also things like ginkgo biloba that causes bleeding in the eye. You can take blueberry extract, mega concentrated, and that'll cause bleeding in the eye. So people think that they're taking good things. So what's wrong with a blueberry? If one blueberry is good, let me just take 1,000,000 of them in this capsule. Well, obviously your body's not used to seeing 1,000,000 blueberries, and that will have interactions with all these processes, because it's not clear what they do to sodium, potassium channels in your cells, which are all these little gateways in your heart, in your kidney, in your brain. So it's very important for us to understand what our patients are doing and what they're eating, because some people feel that if you're taking a vitamin, oh, I'll just take more. The more, the better. But certain vitamins are stored in your liver and fat components, such as vitamin A. You can get bad things if you take too much vitamin A. It doesn't come out every day. And vitamin D, vitamin E, it affects all your membranes at the cellular level of the organs. But one other thing I wanted to address was, Audrey, you're fluent in Mandarin. There are other dialects. Tell us about the other dialects.
Yeah, so there are many dialects depending on which area you come from in China. I know that Mandarin and Cantonese are the top two, and then there are also Shanghainese, and then just the provinces, different dialects. Even in China itself, it's difficult to communicate by language, just because the language barrier. Although now that there's written, it's all the same. So it's easier to communicate by writing rather than speaking.
But some of our Chinese patients are illiterate. They don't read Chinese that well.
Right.
Chinese, the written language is the same. The pronunciation is different, as Audra said about the dialects. And within China, they have 82 ethnic minorities. And the ethnic minorities speak slightly different dialects, especially the ones in Tibet and Mongolia, or who moved into China. So it's a very diverse country. And then you have Korean. They speak different language, even though we're all part of East Asia. They left China like 700 AD, so they're different. And the Japanese, that's a different language. And all of it is different. They're slightly culturally different. And there's Tagalog in the Philippines, the islands, and there's Indonesian. They're all East Asian, and many of them speak some sort of Chinese, but it's very hard to communicate when you don't know where they are in East Asia. And culturally, they're slightly different as well. Whereas the Japanese are more westernized. They're used to seeing Western doctors, Western medicine. Whereas if you go to the more Buddhist countries where they really believe in Buddhism, like such as the countries in Southeast Asia, it's harder to communicate, as such as in this family discussed in this book by Anne Fadiman. Tell us about the Vietnamese community, their cultural barriers. It's affected their care. Breast cancer is high. Tell us a little bit about that.
I think so. I think there's there's a social stigma kind of with not being able to speak English fluently. Because I think a lot of them are kind of scared that they won't be able to interact, all the way with the doctor, and they're worried about not being able to express, clearly what they're experiencing, and a lot of them are afraid of getting these tests and going in to get free screenings. And that's why there's a higher rate of breast cancer, a high rate of cervical cancer in the Vietnamese community.
That's true, because the screening clinics are conducted in white communities, and it's by white doctors, because they're not free screening for Vietnamese in South Bay. I see your point. I also think that there's a fear. Some of the Vietnamese ladies do not want to be touched in their private parts, and they feel, especially if they're 80 years old of that generation, they feel they don't want to know. Do you feel?
That's true, yeah.
Or also they feel that it's fate, a sense of, okay, this is what grandma has. And
I think so too. I think it's part of like their culture. The Vietnamese culture, they're pretty conservative and very traditional. I think the older patients, they grew up in Vietnam, so they're not used to having people touch them or having that kind of interaction, even with doctors. And so I think, as a physician, you probably have to be more sensitive to, these kind of things, right? Yeah.
I think that I've been really fortunate in that I was born in Cuba. I'm Chinese, so I was thrown into many cultures very early. And so by the time I spoke English, it was my third language. I think that it has made me very culturally sensitive to what it's like to be an immigrant. My parents were immigrants. And I am an immigrant. I came over to America at age 6. And I'm totally aware of the even mental barriers. There's mental health issues because sometimes they feel vulnerable, and that vulnerability in terms of health makes them feel that they want to go into a corner and hide more rather than coming out and saying, look, I don't feel good. I demand to know what's wrong. I'm going to get a second opinion, a third opinion. I'm going to sue you. I want to know. Instead, people go within themselves. They feel embarrassed, that what's wrong with me? Why do I have a headache? Is it me? But it could be something simple, that their high blood pressure pill is just too high. The dose is too high. It's not that, or they feel that, oh, I'm stressed. My doctor says I'm stressed. I have to relax, and that I have to take this pill. Why should I be stressed? Am I a bad father? I can't handle the stress. Why can't I provide for my family? So they internalize it in a way that many people don't need to internalize. They can say, some people say, okay, I'm stressed. I'm just going to change my job. The hell with this. I'm doing this. But I think a lot of Asian men feel, oh, the doctor says I should relax. Am I not tough enough to handle this? They take it in. They don't say, it's not me. Let me just go exercise. Let me just get over it. They internalize and find fault. Or the wife who says, oh, the doctor says, I'm borderline diabetes. I have to lose weight and exercise. What's wrong with me? Why can't I lose weight? I feel bad. I'm a bad person. But really, the person could just have low thyroid because they gave birth. And 40% of women after giving birth have hypothyroidism. Nobody checks them. So they're wandering around still having their pregnancy weight, but meanwhile nobody's checked them for hypothyroid, and they should just get over this and they should be fine. So there's a lot of not talking to the doctor. They don't go on blogs. I don't think they're going on. Grandma at age 80 who speaks Vietnamese is not going on a blog, which is too bad, because grandma age 80 in California who's Caucasian is going on a blog. So there's a difference. There's a problem. And we should do more outreach in a way to reach this group of people. Yeah, I know that there are a lot of screening health fairs. Were there in Berkeley healthcare for the Vietnamese and Asians?
Actually, there was, because you know, in the Vietnamese community, in the Asian community, there's actually a high prevalence of hepatitis B, because a lot of people don't get the screenings that they need. But hepatitis B can be prevented with vaccinations. So there's actually organizations on campus, such as for something called VIO, which is like the Vietnamese Health Interpretation Organization. So it's like people go out to the community and they go to the hospitals and doctor's office, and they help interpret, help translate some of the interactions between the doctor and the patient. And I know there's the hepatitis B organization on campus, and every weekend they conduct free screenings at the clinic, so in Oakland.
Oh, that's really good.
Yeah, so there are a lot of resources out there, just people don't take advantage of it.
I think there's also a vibrant Vietnamese radio community, that they have doctor talk shows in Vietnamese, because I've been invited to speak, except I don't speak Vietnamese, so I have not gone. But I do know that for my Vietnamese patients, they enjoy that. They like hearing what Vietnamese doctors say. Same thing with Chinese radio. There's a lot of health shows on radio.
Yeah, and there are also a couple on just TV too, TV broadcasts.
Yes. Yeah. And so people are getting that, and I know that in the World Journal right here, they have certain days they just advertise the doctors' ads. So many people go on this to find out what doctors are saying. And there's also Epic Times, another Chinese newspaper. They regularly interview doctors. I have been interviewed by various Chinese radio shows, and I know that they like that. They like hearing what's up, going on, new. And I know that, of course, in English-speaking television and radio, there's many, many health talk shows and health blogs. On our website, justforeyes.com, we have blogs. People can blog on, tell us everything but what they think. We answer them. And I think blogging has really made it wide open for all these communities. The Spanish television is huge. Right. It is bigger than American television right now, American broadcasting, and they have many doctor shows, and it's very popular. Now tell us a little bit more about what your experiences are in my office dealing with patients. How did you realize that cultural sensitivity was important? What do you think?
So like a lot of the patients that come in, like a lot of them do speak Vietnamese to me, and so right from the bat, so they speak Vietnamese to me. So I know that they're probably not as fluent in English, and I know like a lot of times they look to me to get me to translate what you're saying to them, and they trust me as an interpreter, and I want to be able to translate as accurately as possible, so that they get the right diagnosis and understand their medications.
We try very hard in providing help. We've walked our Vietnamese patients to the parking lot. We've walked patients to the hospital. Haven't we done that? Yeah. And so we feel that we know that they're afraid. The hospital, to many older Vietnamese patients, age 80, they think it's a place of death. They're so afraid, don't you think? They're so afraid of going in. They'd rather go to a surgery center, right? Yeah. They'd rather go see a doctor in a doctor's office because they're so afraid of walking inside a hospital. If you walk into a hospital, you realize you park your car, then you have to walk like 3,000 feet to the office, right? You have to walk down through long corridors, up an elevator, through another corridor. By that time, grandma's exhausted, and the person accompanying grandma is exhausted, right? Because all these long marble corridors with these signs, multiple stimulation, beeps, and noises and people with ivy poles. It's very daunting.
No one wants to go to a hospital.
Yeah.
Yeah.
You know, if I were sick in Paris, France, and everyone's speaking French, I'd be like scared. And I even speak French. It's very scary. So what do you think about the Chinese patients? They feel equally scared, don't
Right. And a lot of the Chinese patients, they sometimes try to understand English and they try to speak English just to be able to connect with the doctor more. But at the same time, it's not exactly the same because they aren't understanding exactly what the doctor is saying. So it's important to have it spoken in their primary language to be sure they have all the instructions right, the diagnosis right, the treatment right.
I agree. I mean, I speak Mandarin, although this is not my first tongue because I really was born speaking Cantonese. And I've managed to communicate, but I also have a Chinese translator, and we write it out in Chinese, and we have a Chinese dictionary, and we have everything written in Chinese. So we try so hard. Then we call their parents, their loved ones, their sisters, brothers, children, to let them know what the diagnosis is. And we certainly do not do surgery unless we talk to everybody, and we do, you know, because it's so important in the Chinese community to get it right. Well, we have just a minute remaining. What is our take-home message for our home audience? That see a doctor.
Right.
Don't be afraid. Most doctors' offices have translation now, although it's not required,
Right.
but definitely every emergency room does. Have your list of medications written in English just in case in your wall at all times. Thank you for joining us at Health Talk. We're so happy you're here with us in the audience. If you'd like to make a contribution to KSAR TV, please do so. David Lee is our station master. He's fabulous. He will entertain all sorts of phone calls, and we would be happy to have your donations to keep this type of programming available for the community. Thank you again, and see you next time.